Excellent. So what I'm doing is I'm clipping the hair and I'm shaving just part of it at a time so that I don't clip more than I need to. So I want 10 black points across, and then we want 4 rows of those, which we will use as our guide to injecting the test material. So we're going to start doing the injections, and we have the syringes. We have 6 different trays of syringes, and they're all labeled with the content and the number of the injection site. So we start with the negative control, and the needle goes just barely under the skin, and we inject a very small amount. So you get a little bit of we call it a bleb under the skin. So a little bit of bleb, and the idea when you're injecting these is to make all the blebs as uniform in size as possible. And each of these syringes contain a different ingredient to which dogs and cats, and humans for that matter too, are allergic to. So the actual pollens in very, very minute amounts. Cats tend to react a lot faster than dogs, and they react more subtly, so they're not going to get the nice hives that dogs usually get when they react. People often will get little hives too. Cats will often get just this little blush. So it's a little bit more difficult to read a cat skin test. So now that I'm done with the first tray, I'm going to read this test. So I'm going to take our test results here and the pencil. And the pencil is important because sometimes the size of the wheel will change. You can see that these reactions back here are not quite as big as the negative control here, which we call 0, and the positive control, which is right next to it, and it's called 4. So everything gets rated based on that scale. We have a tiny little reaction there on number 10 too. So we're going to wait and see if that develops. And the pencil is very important because, as I said, if these change, then we need to be able to alter the numbers on the score. These are tiny amounts that we're injecting, so the volume of the syringe is not, full volume of the syringes that are not injected. You'll see that most of it's left. We can see some reactions, some nice reactions here in the second row that are starting to develop. So these 3 here, very good reactions. So you can see the negative reaction now is that very first one here, and there's not much reaction at all. Right next to it is the positive control, so we call the first one 0, the second one 4. And then you can see that these reactions here are in that spectrum. Some of them are negative and some of them have some good positives. We look at the redness of the reaction. We look at what's called the tensile strength, or the just how it feels when you're running your hand across it. And we look at the size of the wheel too, and these are actually starting to develop into some nice wheels. And we have a small reaction here, and a 0 and a 4, and that is the skin test. So once we're done reading it, we put a little bit of hydrocortisone lotion on it to make them feel better. And this is just a 1% hydrocortisone lotion that we put on. And then we will reverse her, and you'll see her wake up and wonder what happened to her side. A bit of this, and give it in the muscle. So